Hi everyone, I am Dr. Rahul Agarwal, Consultant Vascular and Endovascular Surgery, Care Hospitals, Hyderabad. Today's topic is who should be referred to a vascular surgeon. Now this is the most commonly asked questions by other medical fraternity and even by the general public, that who should be referred to a vascular surgeon. Some think that we treat only the varicose veins or we deal only with the vascular access work, but unlike the other specialities like the neuro, the cardiac or onco or the medical, the branches are divided into medical and the surgical, where they have a medical counterpart. That is, if we have a case of a cancer, then the medical oncologist treats it, and if he sees that there is a requirement of a surgery, then he refers it to an oncosurgeon. Similarly, if there is a cardiac issue, the patient may be referred to a cardiologist, who if sees that there is a requirement of a surgery, he refers it to a cardiothoracic surgeon. But in vascular surgery, it is not so. We prefer to see a patient who is at a risk of developing a vascular disease, such that if a patient is at risk, we can treat him with medical management or the lifestyle changes. So if a patient has any requirement of a surgery, then we can take up the surgical part as well. So we can treat a patient with both prevention, the medical management and the surgical aspect. So coming to the point where which patient or who should be referred to a vascular surgeon, we prefer any patient above age 50 years with diabetes, at the risk of developing diabetic ulcers or diabetic foot. They should be referred to a vascular surgeon for assessment of vascularity. Any patient with unexplained lower limb pains or upper limb pain, they should be referred. Any patient with abdominal pain who are having any uncontrolled hypertension or an incidental finding of an aneurysm or aortic dissections, they should be referred to the vascular surgeons. So that was the spectrum of patients with suspected vascular disease. Now there are patients who are definitely indicated for some vascular interventions, like the patient with the diagnosed aneurysm, dissection, lower limb ischemia, acute ischemia, or the diabetic patients with chronic limb ischemia. I hope with these points we can be aware, or we can make a decision as who should be referred to a vascular surgeon. Thank you.